A smile is the best makeup of a girl. Now, continuing the antibiotic classification, inhibitors, the second group is inhibitors of the bacterial cytoplasmic membrane. These combine with the cytoplasmic membrane and alters their permeability, leading to the leakage of the cellular contents and the death of the cells. Biological membranes are composed basically of lipid proteins and lipoproteins, making the cytoplasmic membrane, which just surrounds and safeguard the cytoplasmic contents. The cytoplasmic membrane also acts as a diffusion barrier for water, ions, nutrients, and transport system from inside to outside. The known compounds are of this group are polymyxin B, polymyxin E, the other name is colistin, gramicidin, tyrosidins, and valinomycin, which act through bacterial cell membrane inhibition. And here, if you do see the structure of the gram positive and the gram negative, this is the plasma membrane or the cytoplasmic membrane, which is green in color, and here it is also the plasma membrane between. Basically, it surrounds the cytoplasm or safeguard the cytoplasm. So this is just outside the cytoplasm, and here one can see more clearly the cytoplasm blue in color that is being surrounded by cytoplasmic membrane, so that is to keep the contents of the cytoplasm safe inside of the bacteria. Now, polymyxins are the family of the antibiotics produced by the species of the Bacillus polymyxa, a bacteria which produces this antibiotic but does not kill that bacteria itself. It exhibits potent anti-pseudomonal activity, cause serious nephrotoxicity and neurotoxicity, so their use is clinically limited, used in the topical preparation and the bowel decontamination regimen, where it is very important to use that antibiotic and that is unavoidable. So used only as life-saving measures. These agents can be divided into cationic, anionic, and neutral agents according to their nature. Here one can see the Bacillus polymyxa, and that is capable of making polymyxin B and polymyxin E colistin, which is used for the gut sterilization in certain gut surgeries. And number 3 group of the antibiotic is inhibitors of the bacterial protein synthesis and ribosomal function. These are mostly bacteriostatic but also bactericidal. Some of them are. Ribosomes are the protein factories of the bacterial cells. Bacterial ribosomes consist of a small 30S subunit and a large 50S subunit. So the antibiotic act on these ribosomes. They differ from those found in the human cells, which are 40 and 60 and collectively called 80S ribosome. But the antibiotic act on the bacterial ribosomes, which are 70S ribosomes. High levels may interfere with the human ribosomes. Also, if the more quantity of the antibiotic is given, that can act on the human ribosomes also. These antibiotics interfere with 30S and 50S ribosomes, subunits of the bacteria separately sometimes. So the 30S binders which act on the 30S subunit of the ribosome, these are the aminoglycosides and the tetracyclines. The antibiotics which act on the 50S subunit of the ribosome, and these are called 50S binders. These are the macrolides, clindamycin, chloramphenicol, streptogramins, and mupirocin. And here one can see the 70S ribosome. As you can see, the large subunit and the small subunit, and large subunit is made of 50S and the small subunit is made of 30S, but collectively these are called 70S ribosome, and in human the ribosomes are of 80S. So the 30S binder first, that bind to the 30S smaller ribosomal subunit and blocks formation of the initiation complex. These include aminoglycosides and tetracyclines. First, the aminoglycosides, these are derived from the Streptomyces and Micromonospora. They act on the many gram-negative and some gram-positive bacteria. They are bactericidal in nature, show synergy with beta-lactam agents, so work more efficiently is combined with beta-lactam antibiotic. Not useful for anaerobic or intracellular bacteria. Their resistance is common, and adverse effects are they are octotoxic, act on the ears and just damage the ears and damage the kidney. So these are called nephrotoxic also. The antibiotic in this group are gentamicin, tobramycin, amikacin, streptomycin dihydro, streptomycin, kanamycin, spectinomycin, natilmycin, neomycin, which is used topically, fremastine, paromycin, and cyclomycin. Here one can see the Streptomyces fradii, the fungus capable of making these aminoglycoside, then Streptomyces griseus, that is also a fungus, and then this is Micromonospora, that is also capable of making the different aminoglycoside. And here one can see the kidneys and the ears are being damaged by the different antibiotic of this aminoglycoside group like gentamicin, tobramycin, kanamycin, and other aminoglycoside molecules which are capable of causing aminoglycoside toxicity. And the major toxic effects are ototoxicity, that damage the ears, and the nephrotoxicity, that is the kidneys are damaged. Now the tetracycline group, these are mostly bacteriostatic, and spectrum of activity is they are broad spectrum, useful against intracellular bacteria, and that is the beauty of these tetracycline. These are the only bacteria which work inside the cell, and that is why these are called intracellular bacteria. Their resistance is very common with these bacteria, and their adverse effects are destruction of the normal intestinal flora, so increased secondary infection, prone the body to make secondary invader to get infected, and staining and impairment of the structure of the bone and the teeth, as one can see, that is just because of the tetracycline and this minocycline and the doxycycline. These are all notorious for causing all these side effects of gut and teeth staining and other. Now, coming to the 50S binders, the subunit, these are macrolide, lincosamides, clindamycin and lincomycin, chloramphenicol, streptogramins, fusidic acid, oxazolidinone, and mupirocin, and glycylcyclines like tetracycline. Here one can see the protein synthesis inhibitors, that is aminoglycoside, blocks the initiation of transition and causes the misreading of the messenger RNA. Tetracycline blocks the attachment of the tRNA to the ribosomes, as one can see. Streptogramins each interfere with the dietrinol steps of the protein synthesis. Similarly, The macrolides, they prevent the continuation of the protein synthesis, and chloramphenicol prevents the peptide bonds from being formed, and lincosamides, they prevent the continuation of the protein synthesis, and the oxazolidinone, they are thought to interfere with the initiation of the protein synthesis. So that is the different protein synthesis inhibitors mechanism of action. Some act on 30S, as one can see, the amino acid and tetracycline, and the rest, these are acting on 50S subunit. These are the macrolides, chloramphenicol, lincosamide, and oxazolidinone, and streptogramins. These act on this 50S, the green color subunit. Now, coming to the macrolides group of, these macrolides are the useful bacteriostatic agents, and they are bactericidal at the higher doses, but at the lower doses, these are bacteriostatic. These are second line drug for the patient with the penicillin hypersensitivity. So this macrolide group is used instead of penicillin. Then these inhibit gram-positive species more and few gram-negative species like Haemophilus, Chlamydia, Legionella, and Mycoplasma, but basically they act against the gram-positive species more, and the resistance is very common with these bacteria, and these bacteria include erythromycin, roxithromycin, clarithromycin, azithromycin, roxithromycin, spiramycin, and ketolides. These are all included in macrolide group. Now, the next group is lincosamide, which include clindamycin and lincomycin. Clindamycin, lincosamides resemble macrolides in mode of action. Biological source is streptomycin, lincolnensis, and semisynthetic derivative of lincomycin. It covers anaerobes and gram-positive aerobes, widely used for the head and neck infection, and side effects. Side effects are rash, neutropenia, pseudomembranous colitis, and the lincomycin. It is acid stable, can be given by mouth, but mostly being used by injection. Widely distributed in tissues except central nervous tissue system. Not suitable for meningitis when it is not going to enter the CNS, so it is not going to be effective against meningitis. Excretion is mainly through liver, bile, and urine, and mostly used for the staphylococcus infection of the bone, or rather one can say the drug of choice for osteomyelitis and other bone infection. The chloramphenicol, the next antibiotic, is produced originally from the culture of streptomycin venezuelae, now manufactured synthetically, bacteriostatic broad-spectrum drug used in treating typhoid fever and meningitis, rickettsial chlamydial infection, and eye infection in the form of eye drops. Great anaerobic drug in brain abscess, so works well in case of the brain abscess very well. Very toxic bone marrow suppression and causing aplastic anemia, which can be fatal in the neonates. So that's why it is being used very less nowadays to avoid these side effects. The fourth is streptogramins, isolated from Streptomyces species. Derivatives are suitable for parenteral administration, and quinupristin and delphopristin have been developed as combination product, effective bactericidal agent against many gram-positive bacteria, those resistant to the beta-lactam drugs and vancomycin. Still, they are sensitive to the streptogramins. It is available as Sinercet, and side effects are arthralgias, myalgias, hyponatremia, and jaundice and phlebitis sometime when it is being used IV. Fusidic acid is an antibiotic with steroid-like structure but no steroid-like activity. It is effective against gram-positive cocci, excellent but modest activity against gram-negative bacteria. It penetrates well into the bone, so best to treat staph osteomyelitis. And as you know, that lincomycin is also very good in osteomyelitis. So this is also one of the antibiotic which is very useful for osteomyelitis. In combination with a beta-lactam antibiotic can be used for the resistant variant and activity against protozoa like Giardia lamblia and Plasmodium falciparum has been also proved. So can be given in this intestinal infection by the Giardia and the malarial fever by the Plasmodium falciparum. Here one can see the streptogrammin, the fungus which is being produced, just going to produce it and available as Sinercid. This is the Fusidin, as it is available as topical as well as the systemic use tablets, so can be used according to the need. The sixth one is oxazolidinone. It is available only as linezolid, blocks formation of the initiation complex, active against streptococcus and enterococci, no cross resistance with other antibiotics. It is reserved for the multi-drug resistant enterococci which is not responding to the ordinary antibiotic, community acquired pneumonia, bacteremia, skin and soft tissue infection which are resistant to the other antibiotic. The seventh antibiotic is mupirocin. It is a naturally occurring antibiotic produced by the Pseudomonas fluorescens, formerly known as pseudomonic acid. It consists of the monic acid. It halts protein synthesis, effective against gram-positive cocci, Staph aureus, MRSA, methicillin-resistant Staph aureus, Staph epidermidis, and Streptococcus like Streptococcus pyogenes, used only in the topical preparation because it is inactivated when it is given systemically. So locally and topically it is very effective. Here one can see oxazolidinone in the form of linezolid tablets, and here the mupirocin, the bacteria which produce it, and it is available as ointment. It is being used very effectively for the nasal carrier of Staph aureus and just being applied in the nose to just get rid of these carriers. Now, eighth antibiotic is glycylcycline. Glycylcycline. It is synthetic analog of the tetracycline, derivative of the minocycline. Only one agent is available, that is by the name of tigecycline. These are inhibitors of additional sites of the ribosomes, binds more avidly to ribosome. This stronger binding is responsible for enhanced activity. These are active against a broad spectrum of gram-positive and gram-negative pathogens, also effective against atypical bacteria and anaerobes, parenteral agent with half-life of 40 hours, so can be given once time only. Tigecycline, it's the injection available, and this is just unbelievable that a fish can just come and rise to the tree. This looks like very unusual, but the picture which has been taken by the photographer, it is unique in the sense that one can't believe that fish can climb the tree. And here one can see the fish that has climbed on the tree. Now, the other fourth group, the D group, is inhibition of the nucleic acid synthesis, DNA or RNA. Nucleic acids are the brain or the genetic material which replicate to produce the bacteria. Failure of the DNA to replicate leads to the failure of the bacterial reproduction. These antibiotics interfere with nucleic acid synthesis at the several different levels of the bacteria. They inhibit nucleotide synthesis or the building bricks of the nucleic acid, and they prevent DNA from functioning. They interfere with the enzyme polymerases involved in the replication and transcription of the DNA. So at the different level, these antibiotics inhibit the DNA or RNA of the bacteria. These include quinolones, rifampin, nitromidazole, the metronidazole, the flagell, and the chloroquine used for malaria. The quinolone first, these are bactericidal antibiotics, very strong antibiotics. These block DNA gyrase, topoisomerase 2 of the DNA. So no DNA replication can occur, failure of the bacterial cell to reproduce, and these agents can interfere with the nucleic acid synthesis at several different levels, I have already told you. And these are effective against aerobic, gram-negative bacilli, streptococcus, mycoplasma, and pseudomonas bacteria. Gram-positive aerobic bacteria also all have major side effect of the phototoxicity and the CNS symptom, which majority of the patient, those who are unable to tolerate these antibiotics, they do complain. They are classified into 4 generations and according to their appearance in the market. The first generation is nalidixic acid, second generation is ciprofloxacin, norfloxacin, anoxacin, ofloxacin, levofloxacin, third generation is gatifloxacin, fourth generation is moxifloxacin and gemifloxacin. Many of the other, these quinolone came into the market, but that have been abandoned due to a certain reason, like intolerable side effects and disapproved by the FDA. So these are now which are available in the market. Ciprofloxacin is the most potent against gram-negative bacteria, used mainly for the typhoid, and gatifloxacin, moxifloxacin have increased potency against anaerobe bacteria. The inhibition of the nucleic acid synthesis continued. That rifampin biological source is Streptomyces mediterraneae, a bactericidal antibiotic, inhibit DNA directed RNA polymerase and also called inhibitor of the RNA synthesis. That is broad spectrum, but is used most commonly in treatment of tuberculosis. The next group is nitromidazole. It is containing metronidazole. It inhibits anaerobic bacteria and protozoa. The drug then binds to the DNA and DNA breakage occurs by this nitromidazole. Then chloroquine, anti-malarial drug used to kill malaria parasite. Here one can see the fungus capable of producing rifampin, and these are the tablets and the capsule of the rifampin. Similarly, metronidazole 400 milligram inject tablet and chloroquine tablet for the malaria. These are all belonging to the same group. Now the last group is metabolism inhibitor or antimetabolites. These also called inhibitors of the folate metabolism. Folic acid, a B vitamin which bacteria must produce to manufacture amino acids and the DNA of their bacteria. Otherwise, bacteria cannot survive and multiply. Folic acid is produced from the para-aminobenzoic acid through an enzyme pathway. Sulfur drugs mimic structure of the PABA or para-aminobenzoic acid. They compete for binding sites on enzymes involved blocking folic acid synthesis. by the bacteria, they have a greater affinity than para-aminobenzoic acid PABA in DNA making. These include sulfonamides, which include trimethoprim, sulfamethoxazole, pyrimethamine, trimethoxate, dapsone, and sulfadiazine. You just consider an example of a bread which a person use. Similarly, if bacteria is going to use any bread which is the PABA, and we are going to replace that bread with another bread which is the sulfur drug, and that looks like the PABA, and the bacteria just take that bread considering it the PABA, and just antibiotic goes in and kill those bacteria. So this is just by the way these antibiotics work. Sulfonamides derived from the prontosyl competitive antagonist of the PABA. I have given you the example. Wide distribution penetrates CSF cross placental barrier also, metabolite in the liver, eliminated in the urine. Side effects are the rash, angioedema, Stevens-Johnson syndrome, because of which it has been abandoned mostly now, and causing the cardiac checks in the children, jaundice also, avoid in pregnancy and infants. Trimethoprim, it inhibits dihydrofolate reductase enzyme, making the folic acid 1,000 times higher affinity for bacterial enzyme than human enzyme. So these are just being taken up by the bacteria, similar spectrum and pharmacokinetic profile as sulfas, and side effect folate deficiency, anemia, leukopenia, and granulocytopenia. The other antibiotics, which are grouped as a separate group in others, these are the daptomycin, cyclic lipopeptide, naturally occurring, produced by the Streptomyces roseparous, disrupt cell membrane function as bactericidal, similar efficacy as vancomycin, a parenteral form administered once daily, used for the complicated skin and soft tissue infection by the resistant gram-positive cocci. Lysostaphin, biological source is Staphylococcus simulans bacteria which produce this antibiotic, cleaves pentaglycine cross-links unique to the Staph aureus cell wall, especially the cell wall of the Staphylococcus bacteria. These antibiotics are especially able to break those cell wall of the staph. Oxacefin like letamoxif are broad-spectrum beta-lactamase stable compounds. And here one can see that daptomycin for injection and the lysostaphin, the antibiotic, also available in the market. So the summary of that classification of the antimicrobial: inhibit cell wall synthesis, penicillin, cephalosporin, carbapenem, monobactam, and vancomycin. Those which inhibit protein synthesis, these are chloramphenicol, tetracycline, glycylcycline, tegacycline, macrolide, clindamycin, streptogramins, oxazolidinone, linezolide, aminoglycoside, and which alter nucleic acid metabolism are rifampicin, and quinolones inhibit folate metabolism, trimethoprim, sulfonamides, and miscellaneous metronidazole and daptomycin. So this is a brief summary of the antimicrobial classification. And here there are sites of the antibiotic activity, as you know: cell wall synthesis, DNA synthesis, protein synthesis inhibition, antimetabolite like PABA, and here one can see that they are working on 50s ribosome subunit, some are working on 30s ribosome subunit, and in total they are just hindering the protein synthesis. Some are working on the DNA, some are working on the RNA, and the ultimate result is that they do not allow the cell to flourish and to just multiply and ultimately make it lies and die. And thank you very much for this lecture, and I wish and I hope so that you will like this lecture and you will prescribe this lecture. If you don't like, you can just give the comments about it, but if you like, please share it and subscribe. Thank you very much.